Hello everyone, it's Matthew McKenzie here. Welcome to another video. What I do is I raise awareness of unpaid carers, especially if you're caring for someone with long-term ill health. Now, this video will focus on NHS and its technical revolution, hence the 10-year plan, but not fully on that, to be honest, because obviously, if I'm an activist focusing on unpaid carers, then I'm going to be talking about obviously unpaid carers. Um, so this will be focusing on the importance of why carers must be part of that revolution, which is basically what it is. It is a revolution if it doesn't seem like that. And I work in the technology field. I work in information technology, and it's something you can't avoid. I can see what's happening. So let's make a start, really. The idea, anyway, and a bit about myself first. I am actually an expert by experience in regards to caring for someone with mental ill health, but also caring for someone else I've known for a very, very long time. And they lived with cancer. So using those experiences, this particular presentation is of main importance because I can see the challenges of digitalization, technology, AI. But there are also benefits as well. And the risk is we as carers can't be left behind. And we'll talk a bit about that in a moment anyway. But there are many advantages on what I tend to do. I run many care forums and groups. I'm involved in the NHS. And I've always found NHS to be involving in regards to experts by experience. Obviously, it's a massive organization. We know that. But I felt in my involvement, I did felt supported with my voice, and I still do. And as noted here, I'm actually a care activist, so I try any sort of method if I can to keep that awareness on unpaid carers, keep that focus on the importance of caring for someone. And I've written 8 books. 2 of them you can see here. One of them being the experience of cancer caregiving, obviously, because of my focus on unpaid caring through those living with cancer. I actually ran the National Cancer Carers Forum. And my 8th book, telling the stories of mental health care. So I'm sort of juggling between 2 different forms of illness, hence that being mental health and cancer. As you can see here, I do what I can to promote uh, those organizations and charities at many community fairs and exhibits. So as the time of this video, we've just gone through now the launch of the NHS 10-year plan. Regarding that launch, it's basically looking at how care is to be delivered by the NHS, the National Health Service. But the big part of that change is basically it's going digital. It is a technological revolution. It might not seem that, and yes, in the past, the government and NHS has focused on use of big, massive digital systems. But there has been challenges, there has been hiccups and that sort of thing, as you know. But the thing is, we cannot avoid digitization, we cannot avoid technology. The only problem, though, is where does it leave unpaid carers? Where does it leave those caring for someone? It's all good and fine to say those working in the National Health Service are providing forms of professional care. But most of the time, patients are not going to be in those hospitals, in those communities, those centres that are providing support. They will be going back, the patient will be going back to live with families, or close relatives providing care. So the role of unpaid care is basically is that we as carers, we manage that medication. If the patient can't do that, we manage appointments. If it's not just for the patients, even for us, for checkups. Because if you're caring for someone, it's not always easy to care for yourself. And unpaid carers or informal carers actually deal with emergencies and emotional support and a whole lot more. If you want to know more about what unpaid carers do check my other videos. But the thing is, it's so easy that carers can often be left out of digital innovations. We're so busy caring for someone, we just don't often have the time to research and look around for anything that can help us digitally in our role. And yet they can actually help us. But it's just trying to work out how. Carers, by their nature, are often standing behind someone, putting others first, and usually being so invisible, they tend to almost put themselves last. But I do feel carers now need to be at the center and not at the sidelines when it comes to digital innovations and how that can be used to help for caring for someone. So we're going back to the NHS England's 10-year plan. What does it say about technology? Well, the point now is that it's looking to expand the NHS app, the NHS online app through the mobiles, expand those bookings, prescription and health information centralized digitally in one place. So those who access that information in order to read up on information can get access to that quickly because it's centralized. There will be use of AI in focusing on scripts to support uh, workers in the NHS. And data in itself is growing. So there needs to be a focus on surveying through that data, making decisions. Can't really look back into the past and do the same what we did before. That's not going to work, and data is growing at an increasing speed. So AI will look to make how can data be processed faster and to provide smarter care. Lastly, the focus is on creating digital health records that follow the patients across services. And this is happening at increasing speeds. This is all happening right now. So I mentioned that technology can actually help carers. I'm not saying it's easy. It never usually is. But if trained and if supported, technology can actually help in fewer phone queues and booking appointments quickly. Carers should be able to see the health info of the person that they're caring for and the test results in actually real time. There'll also be situations on avoiding repeating the same story to every professional. Obviously, that health professional will be accessing digital records to see what the carer was saying or how the carer is going to update the doctor or health professional regarding the patient. And lastly, this will leave the carer to stay more informed and organized and supported during their journey in caring for someone going through long-term ill health. There are barriers, obviously. I've never said this is going to be easy. Some of us struggle with technology. Well, just don't actually own smartphones, especially ones that's powerful enough to deal with the many apps that are out there. And as mentioned, when you're caring for someone, you're not able to earn as much as you would like. And I mean, I can give examples on iPhones. Some of them are hitting almost $1,000. So it's not something you're going to be easily to get hold of. It's not something that is easy to own. And many digital tools out there aren't even designed for unpaid carers in mind anyway. So with all of that, there is a risk of being excluded from the decision-making process when it comes to speaking to the doctor and focusing on care planning. So digital services must be accessible to carers, not just patients. Carers need training and support to use those digital tools. Also, this goes back to the many care centres out there. And also I can think of mental health NHS trusts using recovery colleges to help upskill carers in working and dealing with digital tools. There needs to be inclusion in the care records. We can't let confidentiality block carers off completely out. So there's got to be, again, revisiting that so that way carers can be identified easily, referred to forms of support, whether it be back to the care centre through social prescribing or supporting their loved one. And even before tools are launched or before they're rolled out, carers should really have a chance, have a say on how those tools are designed and rolled out to the public. So going back to what carers can do when it comes to the NHS app and digitization is I urge carers or those watching this video, which is probably going to most likely be unpaid carers anyway, to try the NHS app and see what it can do for you in your caring role. You can also ask your GP, doctor, or pharmacist about digital options and share your feedback on what works and what doesn't. And I'm guessing, I might be wrong, but I'm guessing there will be organizations that might be tasked in getting that feedback on what works and what doesn't in regards to NHS apps. So what is my message to the NHS when it comes to unpaid carers and bringing them into this technical revolution? That's what I'm calling it. Well, we're not just visitors in the system. We're actually part of it. We actually need to use that to help us do our caring role, because at the end of the day, let's be honest, unpaid carers take a lot of pressure off the health and social care system. And if they're not included, that pressure goes back to the NHS. I also feel that it's important not to really just build a digital app without the people holding it together. And this means work for carers activists out there. The idea is, if you're in a carer group, do let carers know about the digital changes. And it's important to share experiences and support each other as carers. But whether we like it or not, the NHS future must include unpaid carers, because we have a chance to shape it for the better. Well, that ends our presentation really for today. If you thought the video was useful, do subscribe. We'll be doing more, obviously, and I'll try my best to revisit this topic. One thing about technology, which is I feel is constant, is that there's always change, whether it be for the better or for the benefit of others. That's how technology is. But I'm looking forward to these changes, to be honest. It'll be interesting to see how things develop. And thanks for visiting, and I'll see you again soon.